Dr. Tarek Loubani is a Palestinian-Canadian physician and a professor of medicine at the University of Western Ontario. And he's served for many years in emergency rooms and as a field medic in conflict zones, including extensive service in Gaza. And he's also director of the Glia Project. I encourage you all to just Google that quickly, GLIA, which develops and provides low-cost medical equipment for impoverished regions all over the world. So we're so lucky to have you here, and we don't have a lot of time.
Gabor, see him there?
Yes, I think Gabor can see Tarek on the screen. Do you two know each other?
No, we can't hear Gabor now.
Oh,
I don't. I can see Tarek. I don't believe I had the pleasure of meeting before, but then my memory has been obliterated.
We've been living and working in parallel, Gabor, for quite a while, and I met a certain Aaron at a checkpoint in the West Bank, which is where I first became aware of you. And that was literally 20 years ago now, so quite some time ago.
And I was in the West Bank just last year, actually.
Yeah.
Nice to meet you.
It's a pleasure. Your reputation and work precedes you, and it's an honor to share a stage with you. And thank you, of course, Bob and Claire, for letting me be here.
So I know you're not going to want to talk too much about yourself, Tarek, but this is a very important segue. For people outside of medicine, that's all of us here today. Can you just give us a sense
from a politeness point of view, Gabor, do you want to stay, and can we, because how should we negotiate this?
I do have to leave fairly soon. If there's any interaction that you'd like to invite between Tarek and myself, or if you'd like Tarek to say something and me to respond, I'm happy to do it. Otherwise, I'm just happy to stay online for another 15 minutes just to hear what Tarek has to say, at the end of which time I'm going to have to leave. So I'm going to have to leave at 25 after the hour.
Okay. Good. So why don't we get your opening statement?
Let's get a little bit of an introduction from Tarek about his work. And then we have already in this class, Tarek, been talking about Gaza, and Gabor has spoken about his relationship with Palestinian struggle. And so that's where we're going to move in this discussion, and I want to focus. But it is important, I think, for those of us who don't know just what it is practically that you're doing to get a sense of that. So, you've traveled around the world, you run this important organization, the Glia Project. Can you just speak a little bit about your work and how you came to it?
Yeah, so I'm an emergency physician. I guess my first connection to the work is through medicine. I had a history doing sort of human rights activism and human rights observation. And so when I got into medicine, it was very clear to me that that was going to be the foundational part of my practice. Obviously, to do this work, you have to be as good or better at these skills as when you're not doing this kind of work, because you're not just practicing emergency medicine, you're practicing emergency medicine in austere environments with lots changing all the time. So, but having said that, I always knew that I wanted to do this kind of work. When I first connected with the struggle, it was through Latin America. That was what got me interested in this type of battlefield type medicine, which is my specialization. However, I'm Palestinian. I'm a Palestinian refugee. So when I started traveling to the West Bank initially and then the Gaza Strip afterwards, it was pretty straightforward to integrate societally in a way that was very difficult for me in Latin America and remains very difficult for me in Latin America. So that's kind of what brought me to it. Like, if there was one seminal moment, it was in Jenin, when I was at this market when it was bombed by the Israelis. Obviously, like, we, especially in medicine, you get into the habit of never really attributing, but I think probably at this moment we need to do that. And so the Israelis shelled, actually not bombed, the market. And if any of you have ever been around explosions, especially war-related explosions, it was very loud. My ears were ringing, so were everybody else's. Everybody was screaming. I was screaming. the dust had sort of filled the air, and we all started running, and I was running too. And when the literal dust started to settle, I realized that most other people had run away from the sound, and I had run towards it. And so I found myself kind of hovering over the bodies of, it's been so long ago, I forget the exact numbers, but I think it was 2 children and a few adults as they bled to death. And I remember just how helpless I felt, how powerless I felt, that they were there, I had arrived there, I had done all the things, but I couldn't help them. And it was kind of that day that I swore to myself that would never happen again. I realized also that there was something fundamentally broken in my brain and the brains of the other people who had run towards the sound. And that's why I went into emergency medicine. To be honest, it's not like I'm that much more helpful nowadays, but at least I have the skill set. At least I can. You know, my friends in Gaza, I was talking to one friend who was in Shifa until more or less the bitter end and just left yesterday. And he was telling me that, you know, the worst part of it was seeing all of these patients and knowing that he could treat them if he just had anything, some equipment, some water, some gauze, some anything, and not being able to, you know. And as he sort of reflected on it, I could see the powerlessness and the helplessness of that moment that brought me into this, you know, reflected in his experiences.
Oh, we can't hear
Or
you,
we can't
Gabor.
hear you, but I think this does, of course, speak to what you
Since this is a communication class, can I ask you a question?
certainly.
So that's the reality. Then there's a communication about the reality. What's it like for you of watching this communication machine invalidating and denying and even justifying the experience?
Yeah, I mean,
what's that like for? I mean, for me, it actually puts me into a rage, and sometimes despair and just brokenheartedness. What's it like for you?
I'm going to skip a little bit forward into some of Claire's sort of future questions here, but I want to start far back. Okay, when I was 10, I became a refugee for the second time in my life. I was born a refugee, Palestinian refugee. And then when I was 10, the Gulf War happened and we came to Canada.
Yeah.
And I remember showing up to a class. I was in Calgary, Alberta, which is like the Texas of Canada.
Yeah.
And I showed up to class and the teacher said, "Well, where are you from?" And I said, "I'm a Palestinian." And the teacher said to me, "No, you're not. There's no such thing as a Palestinian because there's no such thing as a Palestine." And so when you talk, Gabor, about the gaslighting, it's not like it's new to this war. And you know, I know you weren't implying that, you know that.
Yeah.
It's not new at all. It's something that every Palestinian deals with every minute of every day.
Yeah.
When we do not have what is called the permission to narrate, a concept that I think was first articulated by Edward Said.
Yeah.
But I feel like that permission to narrate exists a little bit more for me than it does for other people. For example, my father is quite dark, almost black, and so is my brother. I'm white passing. And so I'm aware of the privilege I have when I talk. Also, I speak English with essentially no accent. You know, if you really pay attention, you pick up that I'm an English as second language speaker. But having said that, I'm aware of the privilege that imparts on me. People listen when I talk. I'm a doctor, you know, like people listen when I talk.
Yeah.
But having said that, you're right. Mechanistically and systematically, Palestinians are robbed of all of their experiences, of all of their abilities, of all of their self-descriptors. Like I was told, I'm not even a Palestinian. When I was shot, and I think, Claire, you wanted to talk about this a little bit later. When I was shot, I sat in front of an MP. This is like sitting in front of a congressman. And he told me, "You weren't shot. You know, I read in this news source that you weren't shot, and I don't believe that you were shot." And it's to that level, the gaslighting. Al-Ahli was so clearly taken out by Israeli munitions, and the Israelis were like, "Nope, not us." Of course, you know, the scoffing that they did. Oh my goodness, the Israelis would never attack a hospital. Where's that scoffing now? You know, they just destroyed Indonesian, Shifa, Rantisi. I mean, every major hospital is going down one by one to Israeli munitions. So yeah, I mean, yeah, I'm very well aware that I don't have the permission to narrate. We fight for that. We don't just fight for our existence as such. We also fight for our rights to tell our stories.
I think it's oh, sorry, Gabor, did you have something you wanted to say?
Oh no, I'm just
and I'm in a similar state.
I'm just shaking my head.
Yes.
Sometimes the words, I make my living through my words, and sometimes the words are just so inadequate.
I feel very similarly. And one of the reasons that I invited you, Tarek, though, is because you're so thoughtful and so accessible in describing what is actually happening for people who are navigating a mediascape that is just saturated with, distortion and suppression. And so I do want to use some of this time today to just ask you, you're in touch with people in Gaza, you've been there. What was healthcare like before the current bombardment? And what do you see happening now? What does it mean when Israel says evacuate a hospital, just practically,
I mean, those are some huge questions, Claire. So I'll try to walk through them. I'm going to meander. Feel free to interject, Gabor, same to you. Jump in anytime, because I'm going to meander. Essentially, when I first started going to Gaza, it was because of the tremendous possibility that Gaza had. And you have to understand that in the terrible siege and blockade that Gaza has been living since 2005, was this clear and obvious chance to do something really special. So let's start with 2005. The Palestinians have an election. The Americans stupidly insist on it, thinking for sure our idiots will win. Their idiots do not win. Their idiots are so hyper corrupt, had sold the Palestinian cause, had done such damage to the Palestinian national identity that it was obvious to anybody paying attention they would lose. And they did. This is what, you can read an article in Vanity Fair called The Gaza Bombshell. I mean, lots of people talk about how much of a fuck up this was on the American part, because all of a sudden they had to negotiate with Hamas.
And I just want to jump in to say that Hillary Clinton's comment was, if we're going to have elections, we should have made sure that the right people will win. This is America's idea of elections. Anyway, please go on.
Thank you, Gabor, for adding that. I hadn't heard that specific comment, but totally fitting with the American stance. And so basically the response from the Israeli side was that we're going to cut everything off. What Shifa looked like back then was basically a primary care center. So Shifa didn't have very much. It was, think of an urgent care or a basic hospital around you that barely does anything. That's what Shifa looked like. So they didn't do major surgeries. They didn't do cancer treatment. They didn't do dialysis. What happened was that doctors, Palestinian Israeli doctors, had come together so well to ensure that regardless of the political situation, medical care was exempt. And so you had these crazy situations in the context of 2023, where, for example, a Palestinian militant might shoot or throw a rock or something at an Israeli soldier, would be shot, and then would be able to get an ambulance, go to an Israeli hospital, knowing full well, everybody knew full well this person was trying to kill an Israeli soldier, would be treated and then released back into Gaza, not arrested in the hospital. It was incredible, right? That was the work of a lot of organizations, but primarily a group called Physicians for Human Rights Israel. And that all died when Hamas was elected. The Israelis cut everything off. It was an absolute and utter siege. So within the first year, every single dialysis patient was dead. Everybody who needed kidney care of really any kind was dead. Within 2 years, all the cancer patients were dead. Anybody who had sort of serious chronic diseases died nearly immediately. That's terrible. That is terrible. That is a crime. Not in I don't know in the legal sense. I'm not a lawyer, but it's a moral and ethical crime. So now we have to think, okay, well, what did that do to the Palestinian system? They recognized that they could not count on anybody from the outside, because the other thing that happened then was all the NGOs were banned from entering through a series of laws in Israel. There were no NGOs functionally anymore. So they realized if we're going to have a medical system, we have to build it ourselves right from the ground up. It had to be indigenous. It had to be Palestinian. And they started building. In 2006, 2007, 2008, they started the first educational programs, resident training programs. Because everybody was dead, they were able, in terms of chronic diseases, they were able to build gradually their system of chronic disease management. So, for example, as people's kidneys failed, they were able to buy more and more machines and build more and more medical care. And this continued until kind of the mid 2010s, where finally the training programs started to bear fruit. You know, they were able to get all the basic training done, medical schools, initial residencies like family medicine, internal medicine, etc. And then they started to work on sort of the higher end stuff. Okay. And this is really like a story of incredible success and resilience. You know, I know, I'm sorry, I use the resilience word. I actually hate the concept of resilience because it relieves so many people of their obligations to people like the Palestinians. But, you know, here we are. I used it. However, even at the best of times, what we would call ayyam al-izz, I don't know if you have any Arabs in the room, like the days of a glory, we would use medications and drugs that were prehistoric in the medical context. For example, have you ever heard of thiopental? Most of my residents haven't. Most of the doctors I work with haven't. Thiopental is like used in lots of these action movies as a truth serum. It's an old school medication, a phenobarbiturate that hasn't been in common use in easily a quarter century, easily, and probably longer than that by now. That is the drug that we had to use to intubate people, to make them unconscious and put them on life support. That is the drug we had to use. It's such a unused drug that actually we had to make a special deal with a veterinarian pharmaceutical company to get some of their veterinarian supply, make sure that it was to the standards for human use, and then use it. Now, the Israelis could have allowed us to bring in propofol. Propofol is the drug of choice. There is some propofol in Gaza, but they didn't. They let us bring in thiopental. Why? Because, you know, they're interested in making these limits. The blockade, the siege is not supposed to catch medical equipment, but it does. And as such, anytime I had a patient who needed morphine, I honestly think it would have been easier for me to get a nuclear bomb than to get morphine. Anytime when I was shot, they offered me Advil, which I think would be the same brand name that you guys have in the States, ibuprofen. They offered me Advil for a gunshot wound. Just think about that for a moment. And I said no, because I knew they didn't have enough for everybody else. There were 1,700 people who were shot that day. So the system was already catastrophically broken. 45% stockout rate. That means that 45% of essential medications were unavailable at any given point in time. Patients were dying. 50% of all Palestinians over the age of 50 had diabetes. You know, and we couldn't treat people, especially for things that weren't life-threatening. For example, you know, a kid, the baby's name is Zaina. A kid Zaina's age, I might have to give her stitches or fix a broken arm without any anesthetic at all. And that was normal. And I think about that, you know, think about that for any of you who have children in your lives, nephews, nieces, brothers, sisters, whatever. That was how it was before. A nearly broken system that was gumshoed together by the incredible efforts of physicians who were determined to create something indigenous. And then the war started. It was in that statement that Yoav Galant made, he said, we're dealing with human animals here. And he wanted to treat the Palestinians as such. No water, no food, no fuel. That's what he said, no electricity. But what he didn't say is no medical supplies. No hospitals running electricity. What he didn't say is that they would bomb the solar panels that we had worked so hard to put on these hospitals. What he didn't say is that all that stockout would never be replaced, that the staff would never be replaced. And so by the time that Shifa was evacuated, 40 days into the war, they were, for all intents and purposes, regular non-medical civilians. They would receive patients. And what the doctors, multiple doctors who I've spoken to who have escaped since have told me, is that by that point, nobody brought anybody who could die. Because anybody who could die was going to die anyway. You wouldn't bother taking the risk of putting them in an ambulance. And so the only patients they brought were the eminently salvageable. I'm going to use medical terminology. I know these are human beings. We shouldn't be talking about salvage, but here we are. Eminently salvageable cases. These are cases that should not die, that would not die anywhere else, that would not have died in Gaza a month ago. And they would sit there while these patients got sicker and died because they had nothing. No medical equipment, no gauze, nothing. I'm going to meander one last step and then bring it back to you, Claire. Gauze, the most basic of things. Have you ever wondered where the word gauze comes from? It sounds like Gaza because it's from Gaza. Gaza, for centuries, they would have this special weave, and that weave was used to make gauze. Gauze is specially woven so that it doesn't break down in quite the usual way. And so the Romans called it gazatum. And as the names evolved, it became called gauze. Zan is very excited about gauze. And so there's a special, delicious kind of pain in being the place gauze came from for centuries, where there's still people who know how to make gauze the old way, like the Roman way. The machines are still around in the Gaza market, and there is no gauze while people die. I'll stop there for now, Claire. Thank you for letting me meander, and feel free to redirect.
Thank you so much, Tarek. It's all very, very difficult to hear. And, Gabor, I'm thinking a lot about some of your insights, and please do jump in, Bob or Max, at any point. But, we're one of the things that you bring so clearly into view, Tarek, is and this has come up before in this class, the insularity, the kind of the protection that Americans and Canadian audiences have from the realities of the world. I remember a friend circulating Arundhati Roy's Come September speech from a year after 9/11 that ends with just like this moment where you have to gently, reach toward people who live within these closed, the closed comfort first world problems, I think is a phrase people use, and say, welcome to the world, And so you write about trauma, the language of trauma circulates right now on this campus, Gabor, in relation to discussion, conversation about what's happening. And I wonder if you can speak a little bit to like the relationship between primary and secondary trauma. What is it, that's in that communication war that runs parallel and is so essential to the military warfare? How should we be trying to pierce that illusion around this question? What's the most effective way to do that?
Are you asking me?
Yes, please.
Well, let me first of all register my. I'm just appalled. I mean, you know, Tarek, I think I knew everything already. And then when you speak, I realize I knew nothing. Because I know the general outlines, but the practical human details of what you just described, they're news to me. They're not surprising to me, but they're news to me. And it's shocking even for me to hear. And I've been to Gaza, I've been to the territories. And I knew the general history. In 2005, and I think that election happened 2006 to 7, but in 2005, before Hamas was elected in Gaza, there was a study done on trauma around the world in war zones, and the most traumatized children around the world were by that time in Gaza. This was published in the Journal of World Psychiatry. This is before the blockade even. So by the time the blockade started, we just deepened the Palestinian trauma. Already that young population was the most traumatized in the world. And then has been, what, 18 years, 15 to 18 years of that terrible blockade that you described. And on top of that, there's this war. I'm just registering that. Claire, in terms of your question, I'm going to have to say this and then I'll have to leave. We have to be brokenhearted, you know. If you're not, if you can listen to Tarek, and if that doesn't break your heart, you have to ask why not. How are you blocked? Why have you blocked your heart? And why did you block your heart? What pain do you have in yourself that you haven't been able to face, that you can't hear the pain in the experience, and you can't feel the pain in the experience that Tarek is describing? Now, pain is not the same as trauma. Pain is pain, and it's necessary, and it's a healthy response. Pain is a healthy response. So if you don't want to be traumatized, trauma comes from the blockage, the attempt to block the pain. It's the inability to accept the pain and to deal with it. So if you're watching these events, and if your heart is not broken, ask yourself, how come?
You know, I want to jump in here. Just, I'm sorry, if you could give me a few more minutes, Gabor. I was in the West Bank. I was in Gaza at the end of the 6-day war. And I want to ask you a question as a Jew. God, I'm sorry. Normally I'm pretty cool. What is our connection with their suffering? Because when I was there, I was told, first of all, this was the Labor Party. They told me, you come back, they'll be better off than they were under Egypt or Jordan that occupied. Jewish, we have Arab people here, and there was a party line of the Labor Party. And yeah, we don't. You even see it in this documentary, The Gatekeepers, the Shin Bet people who administered. We don't want to become the Germans. We don't want to be these occupiers. And so, and I know this would happen. I'm right on this campus now. If I go outside and find a colleague, they'll say, oh, they had choices. They could have done differently. We didn't want to do this. I'm asking you, where do we Jews fit in, Gabor?
Okay, well, look, just to complete what I was saying before, though, if you don't want to be traumatized, feel the pain. If you don't want to create a wound for yourself in the long term, declare your pain, and declare it to Jew, non-Jew, to anybody who will listen. Don't participate in this by being quiet about it. Speak your truth. Dare to speak your truth. even at the expense of threatening your attachments, your relationships. Because if you suppress your pain, that's where the trauma is going to come from. Now, Bob, in terms of your question, I don't want to take this time to go into a big historical analysis, but the reality is that the Zionist project from the beginning had as its aim the occupation and ethnic cleansing of all of Palestine. So whatever they told themselves in 1967 was already a self-lie. Because if you look at the founders of Zionism, Ben Gurion, Jabotinsky, any of these people, they're very clear what their intentions were. That's why the state of Israel never declared a constitution, nor ever declared its boundaries, because those boundaries in that constitution were always flexible to take over more and more and more and more. And people talk about the so-called Hamas charter with its, has anybody ever looked at the Likud manifesto? It says no Palestinian entity, no non-Jewish entity east of the Jordan or west of the Jordan River. And if you look at the extreme settlers and Zionists, you know what they think? They think Palestine should include all the land between the Nile and the Euphrates. And so that was the dynamic. And furthermore, and finally, when you make yourself into a colonizer, even if you think that your colonialism is justified by your own trauma and your own suffering, but as soon as you make yourself into a colonizer, which means I'm going to take over and dominate a land and a people that are already here, as soon as you do that, you harden your heart. And the more you do it, the harder your heart becomes. So what we're seeing now is I don't know if you've seen this terrible song that actually appeared on Israeli television until it was taken down very quickly. But it was Israeli children talking about destroying Gaza, flattening it, and taking it over again. It could have come out of Nazi Germany, that song. Now, some astute Israelis and some appalled Israelis complained, and it was taken off. But that's where that society is heading. And not because Jews are bad or because Jews are good, but because when you become a colonialist and you're going to dominate somebody else, you have to keep getting harder and harder and harder and more cruel and less sensitive. And that's what's happening. And it's going to continue to happen. And that's what we're witnessing right now. Look, and just to say, Bob, you and I know that there's a lot of Jews that don't agree with that. In the Jewish tradition, going back to the Old Testament, there's always been two strains. One of them being the tribal tradition of this is our land, we're going to kill everybody who lives here. And God at some point even threatens to destroy the Jews because they didn't kill everybody. If you can believe that, don't take my word for it. Read the Old Testament. There's been a tribal, chauvinistic tendency as exists in all people around the world. There's also been that prophetic tradition of justice where pursue justice, otherwise you have no right to this land. God also says that. And God also says, you will not oppress the stranger. You know the heart of a stranger. You who yourself strangers in Egypt. So in the Jewish tradition, Bob, there's those two strains, the chauvinistic, ethnically identified, us against them, and we have the right to do anything. And there's that prophetic tradition. And we're seeing both of that being manifested now. We're seeing Jews being arrested in New York, in DC, for protesting the war. We saw Jews protesting the war in Los Angeles just yesterday, I think, or the day before. You have Israelis, few, speaking out. So we see both. So how we stand towards this as Jews, depending on what stories we're telling ourselves and which strain in our tradition we identify with. Listen, with that, Tarek, it's wonderful to meet you. I hope we speak again. And thank you.
What an absolute pleasure to listen to you, Gabor. Thank you for letting me be here.
Okay, take care. Bye-bye.
Thanks, Gabor. Bye. We only have a few minutes left, Tarek, and I'm not exactly sure where I want to take it, but I do want to make sure that if there are any student questions, we get them in. Does anybody have a question at this point? I think I would like to hear a little bit more about, sorry, I know you've been trying to get to Gaza. I don't know if you've gone a third time, but I would be interested in what you think are the current, priorities for those of us who are paying close attention. And by priorities, I mean, if you can speak to it practically from a medical standpoint, as somebody who, is presumably in touch with some people there, but also practically for those of us who are here, who are in a position to be trying to penetrate and dissuade people of the propaganda.
I always think of it as a bit of a ladder. And I think obviously all of us kind of consider the highest rung of that ladder as going to the place and doing things with your own hands. For example, being inside Gaza and doing work, myself in the hospital. And rightly or wrongly, we all kind of generally consider that to be pretty much the highest rung of the involvement ladder. And so I want to recognize that and invite anybody who wants to go to reach out to me and communicate. There will be delegations going, there will be people going. This is a national, like indigenous national project to create capacity. And I remember sort of talking to one of my colleagues about how everything had been destroyed, everything that I had worked towards, everything that I had done, everything that I had like sort of fundraised for. Many of my students have either been killed or injured or will never be able to sort of work again for mental health reasons. And he said, well, that just means we have to get working and work even harder. And post ceasefire, there is bound to be more effort. And if people want to join, they can. The next step down is covering for those people. So creating the conditions so that people can go. That means logistically, for example, for me to go, somebody has to take my shifts. And so there are people around you. You might not be able to go, but there are people around you who might be able to go, if only for, something logistical, something financial, something academic, whatever. And so helping those people make it is kind of that next rung of the ladder. The next ones are purely logistical help. So for example, sending money, sending equipment, creating conditions for training, et cetera, et cetera. And so I think that that's also another really important thing. Basically making it so that it's possible for them to rebuild the society that they're trying to rebuild. And then the next two down are awareness raising, which is really, really important. Talking to other people about what you know. Talking to other people about like what they can do. Talking to other people about what's happening. And the last one, which I think a lot of us don't give enough importance to, is just knowing the truth for yourself. That is actually the first rung of the ladder. Before you talk to anybody else, before you try to do anything, you have to educate yourself. You have to yourself be capable. So I think these are sort of the main steps in not a bad framework. I know the framework implies a hierarchy, and I don't see a hierarchy. Like my colleagues who make it possible for me to travel to Gaza, I go for 4 months a year. I go a month every 3 months. They are just as important in me going as I am. So I think all of those things are absolutely key. And maybe that presents like a way for people in this audience to engage.
Thank you so much. Did you have any final thoughts? We're going to have to wrap. It's very hard to hang up the phone with you, Tarek. I have a lot of questions, and I hope we can talk more later. But
yeah, hopefully we can have you.
You could do a podcast.
Yeah, I just want to, as a journalist and as a teacher, I don't like to lose my cool. I'm going to do it again. So I don't want to stress. I do think I have an obligation to rationally consider things and so forth. But this is a moment, speaking just as a journalist and as a Jewish person, I just never felt this. What is it? Inadequate. How do you feel? You're a Jewish
I was
person.
saying we have a common friend, Dan Freeman Malloy. I was talking to him yesterday, and I was describing that every time I interact, like I have a tender interaction with one of my children, it's like it flashes. I'm going to start crying. It flashes in my mind every Palestinian child having that interaction with their own mother. That's how I'm living my days. So, you know, I'm also trying to keep it together to have the conversation, because I agree with you, Tarek, about taking seriously that first wrong you described. That right now I believe, and I have great confidence in people when it comes to trying to pierce the illusions and learn about this region they really usually have very little knowledge about. This is one of these profound moments, and you know, a teaching moment, a moment of grand education about the world. You know, I've been learning from Palestinians my entire adult life, and this just, you know, it feels like an intensification of that process.
We do have to wrap it up. I want to thank you for sharing these experiences, and hopefully we can have you back again. And I'd love to do a podcast with you. And so maybe we can maybe do it this week
We'll
or so.
coordinate that.
Okay. And
yeah, absolutely. And thank you guys for having me so much. All I would say to you and to your audience, because I feel a tremendous amount of despair in your voices and in the room. And what I would say to you is that, you know, we think sometimes that we're going to free Gaza. And what I realized in my own experience is that Gaza was what freed me, you know, freed me to be more loving, to be more caring, to be more human. And so this is an experience, this in that very specific and very narrow sense is a gift that the Palestinians in Gaza are giving us by showing us that we are human, and showing us that we do care, and showing us the depth of humanity that's here. So you know, this they will have their freedom that will come. This occupation will end. It is a marathon. And so, you know, temper that profound despair and sadness with a hope, because that despair and sadness, it's like a fire. And you can either let it burn you and destroy you, or you can just, you know, like let it make you so mad and so capable that you can melt steel with it.